Hi, my name's Martin Anson. I'm a clinical psychologist working here at the Centre for Anxiety Disorders and Trauma. One of the groups of people that we provide specialist treatment for here at the clinic is people with body dysmorphic disorder, or BDD. People with BDD believe or perceive that they have one or more flaws or defects in their appearance which make them feel very ugly or unattractive. When in fact other people would think that these flaws are not noticeable in any way, or even if they are very slightly noticeable, it's very, very minimal. The disorder causes very significant interference and distress, and people are often very, very preoccupied with their perceived flaws. It may be on their mind for several hours a day. In terms of symptoms, the most common symptoms are mirror checking, or checking the body, the part of concern, by touch or in photographs. Also comparing of appearance to other people, and lots of avoidance of social and public situations because of the concerns. People are often also seeking reassurance from others about the perceived defects. Also, if people do have to go into social and public situations, they're often covering up or trying to hide the perceived defect. Also, lots of excessive levels of sort of grooming and using of makeup and taking a lot of time to get ready. It can also have a very significant effect on family functioning. The avoidance can lead to difficulties in carrying out tasks and activities with family. Also, people may ask sort of family members to get involved with some of the safety behaviours, like buying of products or always having them accompanied when they go out. BDD can also have a very significant effect on developing or maintaining romantic or sexual relationships. Either in terms of developing relationships, people often feel so unattractive or so self-conscious about their appearance that they can't even consider starting a relationship because of their negative feelings. Or if they do meet someone, it's very hard to maybe take it forward or consider sort of becoming intimate with somebody. And then if they are in a relationship, often it can have a significant effect on the actual relationship, either because of the day-to-day living and the effect of BDD on activities, but also because they may feel very self-conscious in front of their partner. BDD is not an uncommon disorder. It has been very under-recognised and under-diagnosed in the past, but the most recent large-scale surveys indicate that BDD affects about 1 in 50 of the population, and this is fairly even amongst males and females, so both males and females are fairly equally affected. In terms of beliefs, it's important to recognise that often people with BDD, especially at the early stages, often will not sort of maybe acknowledge or believe they have BDD, because they'll say, well, my defect is actually real, this is a physical problem, and they may seek help elsewhere, such as through cosmetic surgery or dermatological treatments. And that's part of the thing to work with, to help people consider that this may be a psychological problem, about perception, a body image problem. In terms of treatment, the treatment we provide here at the Centre for Anxiety Disorders and Trauma is CBT, as many people will be aware of. This is a form of psychological or talking therapy, and in terms of BDD, our aim is to help people gain a different perspective on their appearance, to consider that this is more of a body image problem rather than an actual appearance problem, and to help them gain a more positive and less negative view of their appearance, and maybe help them also to shift, maybe attach less importance to their appearance in defining their identity. And we'll do this by focusing on both the sort of unhelpful, inaccurate or exaggerated thoughts and beliefs they have about their appearance, and trying to have more sort of accurate beliefs about that, and also looking at some of the unhelpful behaviours that people may do because of their concerns, even though they're understandable, like wanting to hide or cover up or check to see if there's any changes, that these actual behaviours can maintain and reinforce the problem, and sometimes magnify the perceived defects, and also stop people testing out their beliefs and stop people getting used to being, say, in social situations and in public. So that's the treatment we provide here for people with BDD. So I hope you found that clip to be of some benefit, and thank you.